Since the war in Gaza began, we've had many doctors and human rights advocates on this program, rescue workers as well, to describe the deteriorating medical emergency there. But we rarely, if ever, actually get to see it for ourselves from their eyes. Dr. Samer Attar is an American orthopedic oncology surgeon based in Chicago. He also volunteers his time in war zones, including places like Iraq, Ukraine, and Syria. He recently spent 2 weeks in Gaza and says the situation there is the worst he has ever seen. In a 13-minute opinion video diary published by the New York Times, Dr. Attar shows us firsthand just how catastrophic the situation has become for Palestinians in Gaza's hospitals. A warning, what you are about to see is graphic and really hard to watch at times.
The longer this war goes on, the more wounds will become infected. The more limbs will have to be amputated. And without more resources, even the people who are lucky enough to survive will be permanently disabled. On one of my last days, I come across a man collecting dirt.
Going up the staircase. Holy cow. You weren't kidding when you said you got a farm.
His wife is pregnant, and he's planting a garden to grow food for his future child.
Inshallah, we will have a baby after 3 months. I try to have some vegetables. You can see the first.
Joining me now is Dr. Samer Attar, who just returned to the U.S. from Gaza last month. Doctor, thank you so much for sharing some time and for the footage you took. I want to just start by level setting your experience here, because I was struck that you've, from a very early part of your medical career, just gone to war zones, to places where you're already under duress from a medical standpoint. And I want to ask you to compare your experience in northern Gaza to what you've experienced in other places.
Yeah, thanks for having me. The thing about northern Gaza, or Gaza in general, is that there are only so many functioning hospitals. In Ukraine, there are a lot of hospitals, there are a lot of staff. And in Gaza, there's only one place, one hospital where everything gets funneled. And so if there's an attack, if there's a bomb, all of the horror, all of the dead bodies, all of the injured, they all get funneled into one spot. And you see it all happening all at once. And I think that's what's so shocking about Gaza, is that it's so small, it's so compact, it's so tight. Millions of people packed together, and it all happens all at once.
You were in northern Gaza for 2 weeks, and that's a part that it's been harder to get to talk to people who've been there because it has been so under bombardment and so evacuated. Tell us where you were and what you saw there.
We worked at Kamal Adwan and Ouda hospitals, which are currently under attack. The World Health Organization dropped us off and basically said, just bring food for a month in case you get stranded, which is what would have happened if we were there. But really, it's just an apocalyptic landscape of rubble and hunger, homelessness, bombardment. Every day we were doing amputations. Every day we were seeing people show up starving to death. We'd see folks, moms and dads, their kids, they hadn't had food or water for days. And at that point, when they come in, the damage is irreversible.
Can I stop you right there? Can I just stop you right there? Because we talked a lot about famine. You're talking about people actually presenting at the hospital starving, like literally starving to death. What do you do as a doctor in that situation? What can you do?
I mean, there's not much you can do except hold the hands of the people that brought them in. I mean, one night they brought in a 20-year-old girl. She was brought in by her dad. At the same time, they brought in a 32-year-old woman. The mom and dad and the son brought her in, and they just hadn't had food or water for days, and she deteriorated. At that point, I mean, you can just give fluids and just see what happens, but they're not responsive. They're not opening their eyes, and they die. And all you can really do is just let the family know that you're there and you did your best. But that's pretty much it. That's medicine in North Gaza.
You talk also about amputations. You talk about having to intubate folks and try with the best that you have. These hospitals themselves have sustained huge amounts of artillery or bombs. I mean, what is the sort of status of just the basics of medical equipment in the actual facility?
I mean, there's blood everywhere. Sterility is a suggestion, as I've said. We're using instruments from like the 19th century. So to do an amputation, we're using manual saws. We're putting in pins without any electricity, without any power tools. Oftentimes we wouldn't have anesthesia. Oftentimes the power runs out. and we're operating under cell phone light. My first mission, I did 11 amputations. I was involved in 11 amputation surgeries in one day back in December, and that's when I stopped counting.
The northern Gaza security situation is particularly abject, as I understand it. The Hamas sort of is no longer functioning there, or was routed from there, although the Israeli military went back in. What is the social order there like? Like, there's no governing authority in any official sense. There's nothing functioning in terms of like the basics of society or governance. What is it like for people there?
Yeah, I never got the sense there was any governing order. It was just a bunch of people in trouble, and they were all relying on each other. They were kind of all relying on the kindness of each other. And the thing about these hospitals is that they're these oases where when people come, they know there are going to be good people there. They're going to get taken care of. That's why a lot of people live there. That's why a lot of people want to live in the hospitals or around the hospitals, because it's kind of like an oasis of peace.
Did you have fighters there? I mean, I know that as a doctor, you give medical attention to whoever comes in the door. This is part of the Hippocratic Oath. Did you have people coming in who had been in gun battles or things like that?
Yeah, we just treat sick and injured. We don't see good and evil, but I didn't see any fighters. I mean, I would have had no idea anyway. So most of the people I treated were women and children.
The last picture you showed, that last video we played, has really stuck with me, of the man growing the garden on his roof and his wife being pregnant. And you talk about the kind of resilience of people there who are just trying to plan for something better than what is there right now.
Yeah, I just kind of ran into him. He's actually the brother of the anesthetist, Tanine. And it's just sad. She is the only one who got back to me. I haven't been able to reach anyone I worked with, any of my friends who I worked with, any of the doctors or nurses at Kamal Adwan or Ouda Hospital. She was the only one. She sent me a voicemail today. I asked her about her brother, but she never responded. And she seemed to be in a lot of distress. So I think about him a lot, too, because he's just trying to provide for his wife and his daughter. But that last shot was right in front of Kamal Adwan. When you look behind them, that's Kamal Adwan Hospital. Yeah. So I don't know if that garden is even there anymore. I don't know what happened to it.
Dr. Samer Attar, thank you very much for your time tonight. I really appreciate it.